My name is Jennifer White, and I am a licensed practical nurse in the baccalaureate program at Indiana State University. This is my second health education project in the spring of 2021, and I will focus on cancer patients and the use of holistic nursing. At the end of this presentation, the participant will be able to broadly define the term cancer, define holistic nursing, provide examples of holistic nursing treatments, and recognize the effects of holistic treatments on the patient outcomes. At this time, please pause the video and take the pretest listed in the comments. Cancer is the second leading cause of death in the world, second only after cardiovascular disease. Cancer is caused by the uncontrolled division of abnormal cells in any part of a patient's body. A diagnosis of cancer is a life-altering process for not only the patient, but for their families. There is a financial burden of treatments, the side effects of the treatments, the changes to the patient's lifestyle, and the questioning of the patient's meaning in life or their spirituality. Cancer treatments are extremely expensive at an average cost of $150,000 and can be necessary for years after the diagnosis of cancer is made. Many people have side effects from the cancer treatment that can include nausea, vomiting, hair loss, anxiety, radiation burns, and loss of normally functioning cells. Many people with the diagnosis of cancer may have to make lifestyle changes that can affect the patient emotionally. They may have to limit their social engagements due to immunosuppression or just being too sick or not enough time to visit after treatments. They may have to quit their jobs, which will add to the financial burden and can result in depression or social isolation, according to Benjamin 2020. Patients will also begin to question the meaning of their life, and this will have an overwhelming impact on their spirituality. Florence Nightingale first proposed the idea of holistic nursing when she emphasized the care of the whole patient and not just the illness or the injury. Florence Nightingale advocated for public health issues such as sanitation. Holistic nursing addresses the patient as a whole and follows them from diagnosis of the disease through treatment, during remission, during representation of the disease, and on to the end-of-life planning if necessary, according to Divinity 2017. Holistic nursing takes into consideration the patient's emotional, physical, and spiritual well-being. Cancer can be treated in a multitude of ways depending on the type and the stage of the cancer. These can include hormone suppression medication, chemotherapy and radiation, and surgical excision. The holistic approach focuses more on the side effects of these treatments rather than treating the disease itself. The holistic nurse enters into a relationship with the patient and takes into account the patient's psychological, emotional, physical, and spiritual health as a goal in the management of care. The psychological effects of a cancer diagnosis can include depression, anger, bargaining with God, and acceptance of the disease. All of these aspects of psychological health must be addressed as they appear and can be different for every patient. The holistic nurse is able to identify the reaction and offer appropriate care needed at that specific time. The physical treatment of the cancer patient includes an in-depth history and physical, assessment of symptoms, and nursing diagnoses geared towards bettering the patient's quality of life. These can include education of disease process, therapies geared toward reducing the symptoms, and medication teaching. The patient may be experiencing spiritual confusion at this time also. The holistic nurse recognizes that spirituality is a subjective evaluation, and every patient is different according to Divinity 2017. Spirituality is how a patient addresses their feelings of self, their relationship with others, and their relationship with a higher power. Holistic treatments can include acupuncture, which is the insertion of fine needles into pressure points on the patient's body that can help with symptoms of cancer treatment, to include nausea and pain. Music therapy is used to relax patients, reduce anxiety and stress, and reduce pain and discomfort. Guided imagery is also used to help focus a patient on happy or calming memories rather than what side effects they are suffering. Aromatherapy can be used for relaxation and to reduce stress also. Lifestyle counseling can include smoking cessation and weight control teaching. Some other therapies include massage, stress management, therapeutic touch, and exercise programs. The use of holistic treatment can provide patients with a balanced lifestyle that allows them to be both physically and mentally healthy. It can improve overall health by instituting healthy lifestyle choices, such as eating healthy and stress management. According to Benjamin 2020, holistic nursing allows a cancer patient to relax, helps them to gain knowledge and an understanding of the disease process, and assists the patient with compliance to therapeutic regime in a non-invasive way. The ultimate goal of holistic nursing is to improve the patient's quality of life by using the best scientific data in clinical treatments. The nurse should be well educated and geared towards a holistic approach to care. Oncology nurses have a unique position to step in and guide the patient through the many aspects of their cancer treatments. Thank you for listening to my presentation.